Hey guys, welcome back to my channel. Leah here. I am bringing you a new video to talk about how to treat bilateral back pain stemming from muscle tightness. Postural alignment plays a key role in developing muscle pain. If you take a look at someone's anatomy from the side profile view, you can take a look at their pelvic line. So we each have a pelvic bowl, which is supposed to sit upright like this, creating a perfect bowl. If you place your pointer and your thumb along that bowl, you can tell pretty quickly whether or not your pelvis is in a neutral position. If the pelvis is rounded forward like this, it creates an anterior pelvic tilt. And in this case, you're going to have shortening of the low back muscles, tightening of the hip flexors, and weakening of the core muscles. This is going to create a shortened position for the low back. It's going to tighten up the fibers in the low back so that way when you go to reach or squat down, it's going to quickly elongate the tissue, and the tissue is not going to have the elasticity to be able to perform that action without pain. If we have this anterior pelvic tilt, we have a weakened glute area, but also a weakened core area, weakened outer hips. So just stabilizing the muscles in the outer hips and the glutes can help pull the pelvic bowl into a posterior direction, which will help neutralize the pelvis and reduce the shortened fibers in the low back, so that way when you're going to do actions, you'll be able to have that elasticity and the stability of your glutes and outer hips to help you squat, to help you lift and reach, and you're not placing all of the force on the low back area. So now I'm going to show you several different exercises that you can do at home in your house without equipment or weights to help strengthen the stabilizing muscles around your pelvic area to prevent pain, to promote strength, and to reduce the onset of injury. Without further ado, let's get to it. Some of these exercises are a little bit more on the difficult side. If they are too difficult, find ways to modify or omit altogether. Stick with the exercises on the floor and work your way up to the more balance-oriented exercises. Please omit any exercises that might be causing aggravation or pain. This is intended to help you strengthen your lower body, help stabilize the low back area, and to prevent further injury. The first exercise we're going to do is called a glute bridge. So you're going to lay on your back. Your heels are underneath your knees, and you're going to press your hands to the sides next to you, push your pelvis downward toward the mat, and then simultaneously lift your hips up, squeezing your glutes at the top and lower down. The next exercise I'm going to show you is a modification. It's going to make you externally rotate your hips a little bit more, and it's going to engage different muscles in your glutes. So take your knees outward, bring your feet together so that way the medial border of your feet are touching, placing the outer edge of your foot along the mat. Squeeze your glutes and lift your hips up and hold for a moment and then press down. The next exercise I'm going to show you, you're either resting on your forearm or you can place your elbow on the mat and use your hand for a resting position for your head. Start with your legs straight, keep your opposite hand in front of you, take that top leg and point it a little bit in front of the other leg. Just keep the toes pointed toward the wall in front of you, and then you're going to lift your hips up, squeezing the glutes at the top. This next one, you can stay in the position, keep that bottom leg straight, bend that top knee, place the leg in front of you, keep your hand in front as a stabilizing factor, and then you're going to lift your knee up, squeeze your glutes at the top, and then lower your knee down. This next exercise, you're going to be in the quadruped position. Your wrists are underneath your shoulders, your knees are underneath your hips, making a square shape. Bend that left knee, lifting that leg off the ground. Keep your knee bent. Keep your heel pressed toward the ceiling. Core is engaged. Lift that heel up and push toward the ceiling, squeezing your glutes at the very top. Next exercise, you're going to be in a lunge position. If you need to hold on to something, feel free to do so. Right leg is in front, left leg is in back. 90-degree angle at the knee. Knee is over the ankle. Back knee starts out in a straight position. Core is engaged, lifting your pelvis up. As I said, you can hold on to something if you are finding a hard time maintaining balance. With this one, you're going to bend your knee and lift. Squeezing your glutes at the top, pressing into that front heel. Switch sides. The next exercise that you're going to do is a side lunge followed by a curtsy squat. So you're going to start out with your knees bent. Your core is engaged. Take that right leg, take it to a slight angle in front. Bend your knee, keeping your knee over your ankle, squeezing your glutes, lifting your chest. And then you're going to press into that heel, come into a curtsy squat behind, and then back. Using your arms in opposition to maintain balance. And switch sides. The next exercise we're going to do is a side step with a mini squat. So you're going to take a slight bend to your knees, keep your knees over your ankles, stick your booty out, stick your chest up. Get that right leg, step out, mini squat, push off with that left heel to meet that right foot. Squat, meet. Squat, meet the foot. Thank you all so much for joining me for my first fitness video. I hope you feel like you worked those muscles and you feel like there's a little bit more stability in your low back.